So my question is, I would like for you to go over Transitional Care Management, TCM leveling for the physician's office. My understanding is that it is based on the medical decision-making only, but I would like to learn more about it. Could you possibly discuss this in the next monthly Q&A webinar? So tonight, that's what I will be addressing. So before I go into the medical decision-making, I will talk about some of the requirements that are, required, for the TCM services. The first one is that services are required during the beneficiary's transition to the community setting following particular kinds of discharges. That means that when the patient is discharged, say from the hospital, a community setting can be anything from a nursing home, a rest home, the patient's residence, his actual home, but it's the discharge to wherever that patient is living. The healthcare professional accepts the care of the beneficiary post-discharge from the facility setting without any gap. They go right into it. TCM starts the day of discharge. The healthcare professional takes responsibility for all the beneficiary's care. Okay. Now, the beneficiary has medical and or psychosocial problems that require both either a moderate or a high complexity medical decision making. So in order to qualify for TCM coding, you have to have either moderate or high complexity. And the 30-day TCM period begins on the date the beneficiary is discharged from the inpatient hospital setting and will continue for the next 29 days. So that if January 1st, they're discharged from the hospital, that's day 1. And on January 30th, 29 days after that, that is the date of service that you would use to bill or code the transitional care management service. You must furnish one face-to-face visit within certain time frames as described by the following two CPT codes. The 99495 is the TCM with moderate medical decision complexity, and that means that face-to-face visit within 14 days of discharge. And the 99496 is a high medical decision complexity, and that has to be done within 7 days of discharge. Keep in mind that the face-to-face visit is part of the TCM service, and you should not report it separately. So it really is important that once you determine that you continue to call that patient until you see them or you to contact them on the telephone, depending on the situation, but it has to be within that time frame. Medical decision-making refers to the complexity of establishing a diagnosis and selecting management options, which is determined by considering the following factors. And the first one is the number of possible diagnoses and or the number of management options that must be considered. And then the amount and or complexity of the medical records, diagnostic tests, and or other information that must be obtained, reviewed, and analyzed. Then the risk of significant complications, morbidity, and or mortality, as well as comorbidities associated with the patient's presenting problems, the diagnostic procedures, and or the possible management options. So there's a lot to consider when you are coding for the TCM. Now the chart below depicts the elements for each level of medical decision making, and note that to qualify for a given type of medical decision making, 2 of the 3 elements must either be met or exceeded. So the next page will show the actual chart right here, and you will see this in the front of the CPT manual as well. But you will be focusing on the last 2, the moderate complexity with the multiple diagnosis and management options, moderate amount and or complexity of data to be reviewed, and also moderate risk of significant complications, morbidity, and or mortality. And the high complexity, which is the other option, everything is extensive and high risk. So those are the bottom 2 that you would focus on if you were going to code for TCM upon a discharge. And I will have a link where you could actually click on to the 95 and 97 documentation guidelines. But the medical decision-making table is located in the front of your CPT manual, and as we learned from Lorene from her E&M presentation, that when you are working with medical decision-making, 2 of 3 elements must be met or exceeded, and you always drop the lowest. And that, if we go to the cco.us, we can move up a second, and there is an understanding the EM coding step-by-step guide, and the medical decision-making explanation is incorporated into this, and that will also help you to determine what level of medical decision-making you would need. Okay, now the next page, you want to keep in mind that the medication reconciliation and management must also be furnished, and no later than the date you furnish the face-to-face visit, and that's very important. There are a lot of guidelines. Okay, and the next page, let's see, when we're billing, okay, only one healthcare professional can report the TCM services, and we report services once per beneficiary during the TCM period. Now, the same healthcare professional may discharge the beneficiary from the hospital, report hospital or observation discharge services, and bill TCM services. However, the required face-to-face visit may not take place on the same day you report discharge day management services, because technically a discharge is a 99238 or 99239, which is a discharge. It's an E&M code, so you're not allowed to, code for that. It's all bundled in. Now, you can report a reasonable and necessary evaluation and management service other than the required face-to-face to manage the beneficiary's clinical issues separately. And I have seen multiple times primary care physicians, when they're managing a patient that is involved with the TCM, that they do incorporate the face-to-face or the communication between the patient or a guardian in their TCM. But sometimes the patient will go in, on the exact day that they're billing for the TCM on that 30th day, and they can actually bill for a visit. So if the patient came in for a different problem that is not the face-to-face that's built into the TCM code, you can bill an E&M with the TCM and add a modifier to the 9921314, whatever the E&M service is, but it is not the E&M that's incorporated into the TCM code. You also cannot bill TCM services if it's within a post-op global period, like a 90-day global period, so keep that in mind. And also, you cannot report the HCPCS codes G0181 and we can move up a little, I think it's G0181 and G0182, the home health care plan oversight, and you cannot bill the end-stage renal disease services. You also, the chronic care management services, and so all of these cannot be billed in addition to the TCM. Now, if we click on the frequently asked questions, this little thing here, and just go down below, and this is a link that you'll be able to have a lot of your questions answered. Oh, there it is. Any of your questions that you might have in regards to TCM that I haven't covered tonight. So that is one option that you can review, and some of it is already touched on what I've talked about, but there's other things, like if a patient is readmitted or things like that, very specific, because there's a lot to it. It's not just the medical decision making, but this is one form. And my other link that I have that's below this, when we go back, this is wonderful. This is where I actually got all my information. Even though I knew it, I took it the way Medicare Learning Network presented it, and it's phenomenal. It's 8 pages that you can print out, and it gives you everything. Like I said, I just touched on a couple of things, but there is a lot more information built into this, and it will help you. It's just, I just touched more on the medical decision making and some of the codes that you can build into it. But this will help you quite a bit, and there are a lot of links there, and the 95 and 97 guidelines, for coding, so that should help you. And basically that's it. It's just, you just want to make sure that if you are coding for TCM, that it is a moderate or high complexity medical decision making. That's very important.
Thanks, Joanne.
So, you're welcome.
And just to let the people know, I did put the links to those last 2 items in the chat if you want to grab them, because that's an awful long one to try and have to write down.
Yeah.
And someone was asking in the chat about getting the answer sheets. The answer sheets are available to our Replay Club members, which is $20 a month. You get the full replay of this whole webinar. You get the CEUs built into it instead of having to pay the $5. And you get a full transcript about a week later. So a lot of goodies that come with it. So, but the regular handouts, the slide deck handouts, are in the GoToWebinar panel window. You can find it there.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.